Today, we're diving into a drug that absolutely revolutionized treatment for millions of people at risk of blood clots. It's called Dabigatran, and its story is all about replacing a tricky, decades-old medical balancing act with some really smart, targeted science. So here's the central question, right? This is at the very heart of anticoagulation. For doctors, for patients, the goal has always been to prevent a life-threatening clot, the kind that causes a stroke, without, at the same time, causing a life-threatening bleed. It's a real medical tightrope walk. For a long time, the main tool for this job was a drug called warfarin, and while it worked, it was incredibly difficult to manage. But then, a whole new class of medications showed up and offered a much more direct, predictable, and frankly, a way simpler approach. To really get why this new drug was such a revolution, we first have to understand the problem it solved. Let's call it the clotting conundrum. Okay, think of your body's clotting process like a domino rally. An injury happens, and that sets off this whole chain reaction. A bunch of different clotting factors get activated one after another. But the final, most important player in this whole thing is an enzyme called thrombin. It's like the master builder. Its job is to create the strong fibrin mesh that becomes the actual clot. Now remember that name, thrombin. It's the key to this whole story. So for over 50 years, the old standard for preventing clots was warfarin. And let me tell you, managing it was a massive commitment. Imagine having to get constant blood tests just to get the dose right, worrying that the healthy salad you ate for lunch could throw everything off. And on top of all that, having to wait days for it to even start working. That was the reality. You can see why this difficult reality created a real need for something better. And that brings us to Dabigatran, a drug that offered a completely new way forward. Dabigatran, which you might know by its brand name Pradaxa, belongs to a class of drugs called DOACs. That stands for Direct Oral Anticoagulants. And that word direct, well, that's the key to everything. So how does it pull off this direct effect? It all comes down to a really clever takedown of a single target we've already met. This is the perfect way to think about it. Remember thrombin, our master builder enzyme from earlier? Dabigatran is designed to find thrombin and block it specifically. It fits right into thrombin's most important spot, essentially jamming the lock, so it just can't do its job of building a clot anymore. And this is the core difference. Dabigatran goes straight for the final boss, thrombin. Warfarin, on the other hand, works way upstream. It kind of tells the liver to just produce fewer of the raw materials needed for the whole cascade. The new approach is just so much faster, more targeted, and way more predictable. So, what does all this elegant science actually mean for the person taking the medication? Well, the difference is pretty much night and day. I mean, just look at this. The practical differences are staggering. With Dabigatran, you don't need routine blood tests anymore. You don't have to stress about what you eat. The dose is fixed and simple, not all over the place. And it starts working in a couple of hours, not days. Every single point here represents a massive improvement in a patient's quality of life. And its impact is felt across a bunch of really critical areas in medicine. Probably its most common use is to prevent strokes in people who have an irregular heartbeat called AFib. But it's also absolutely essential for treating existing clots, say in the legs or lungs, and for preventing new ones after major surgeries. Okay, but let's be real, no drug is without risk. And when you're talking about a medication that's specifically designed to stop your blood from clotting, there is one very obvious, very serious concern we have to address. It's the other side of that medical tightrope we talked about. You stop clots from forming, but what happens if you stop them a little too well? Yep, uncontrolled bleeding. And for a while, the biggest worry with these new drugs was that, unlike with warfarin, we didn't have a specific off switch. If a patient on Dabigatran gets into a serious accident or needs emergency surgery right now, how do doctors stop the drug's effects so the blood can clot normally again? And this is where the story gets absolutely incredible. Science delivered a tailor-made solution, an antidote called idarucimab. Think of it like a smart missile designed to do one thing and one thing only: find Dabigatran in the bloodstream and shut it down. Instantly. It's the ultimate purpose-built safety net. So let's wrap this up and take a look at the big picture. What's the final takeaway on Dabigatran's place in modern medicine? Well, the crucial point is that this isn't a magic bullet for everyone. Patient selection is key.
Since the drug is cleared by the kidneys, doctors have to keep a close eye on kidney function. It's also not the right choice for patients with certain types of mechanical heart valves, and yep, there are other drug interactions to watch out for.
But ultimately, Dabigatran represents a monumental leap forward. It gave doctors and patients a tool that is so much more predictable in its effects, powerful in its action, and profoundly more convenient than what we had before. It's freed millions from the burden of constant monitoring.
You know, the story of Dabigatran replacing warfarin really makes you wonder. It shows that even the most established, long-standing treatments aren't set in stone. They can be improved on with targeted science. It just begs the question, what other cornerstone of medicine is out there right now, just waiting for its own revolution?